Hello, everyone. My name is Shelby Earp, and I am a second-year medical student at the USF Morsani College of Medicine. We're excited to have Dr. Oxner here with us today to talk about global health and the COVID-19 pandemic as part of the In Their Words interview series. Dr. Oxner, thank you for being here.
Thank you.
So just to start off, could you tell us a little bit about yourself and how you got into the field of global health?
Sure. So I'm a general internist and I went to medical school at USF. And while I was in medical school, I did the International Medicine Scholarly Concentration. So, as well as Project World Health at that time. So I got to travel to the Dominican Republic and do those short mission trip type of care with some of the attendings at USF. And then I got to go to South Africa when I was a fourth year medical student to do a longer rotation. It was 6 weeks in one of the biggest hospitals in Africa, outside of Johannesburg, in one of the townships. And that was really what kind of solidified wanting to do global health, because I thought that I wanted to do it, but then, when I got there, it was even more interesting and rewarding than I originally thought.
Awesome. Thank you for sharing that. Since you're so involved in global health, why do you think that it's so important?
So, of course, it's important because where the whole world is kind of becoming one village, right? So everybody matters equally. And patients who don't have access to healthcare because there's not enough graduates from healthcare fields, nursing and medicine in their nation, it doesn't mean that they don't deserve to have access to healthcare. So that's why I think it's so meaningful.
Yeah, I can tell that you're very passionate about global health and medicine. So, what global health efforts were you involved in prior to the COVID-19 pandemic?
Well, USF, we were working on building a global health fellowship. So after you would graduate residency, if you were internal medicine, family medicine, pediatrics, or OBGYN, then you could join our fellowship program. And we made a partnership with one of the government hospitals in Entebbe, Uganda, called Entebbe Regional Referral Hospital. It's a tertiary care center for 7 districts in Uganda. And we were planning to be able to put 2 fellows there year round, with attending support from USF in those different specialties. Now with COVID, that has been delayed both for, travel reasons and travel bans and safety reasons, but also financially because the money that we were going to be using to support that is not available now because of the overall budget being impacted by COVID. So, but that is what we were working on, and have made several trips there and done some workshops with them about quality improvement, about infection prevention. We were planning another workshop on cardiology issues, reading and interpreting EKGs, for example. So that was the brunt of the global health efforts before COVID. In addition, whenever there's a natural or man-made disaster that's kind of within our sphere of Caribbean and Northern Latin America, USF does have a community of partners in those areas, and so we do reach out and help them. So after Hurricane Maria in Puerto Rico, after Hurricane Dorian in the Bahamas, after the earthquakes in Mexico, those kinds of things, we were also there to help out our partners.
All right. So it seems like you have a lot of experience in the field. How would you say that those experiences have shaped your role in fighting the COVID-19 pandemic?
Well, certainly there's a couple things that you learn when you do global health, and one is flexibility, or you might also say resourcefulness, right? That even without electricity or even without having exactly the medicine that you might want, you find out how to use other resources, convert that medicine to another one in its class that could be equivalent, or use different resources to be able to take care of the patients. So that's number one, which has been very important with COVID, because the, resourcefulness and thinking outside the box has been very, very valuable. For example, people are, for a long time, have been doing prone positioning in the ICU for ARDS patients, but why not take that into the home? For a patient who's going to be at risk for ARDS from their COVID, why not explain to them how to do prone positioning, teach them how to do it, and check on them and hold them accountable for doing it at home? So those kinds of creativity and flexible aspects are really, really helpful. And then the other kind of characteristic from global health that's been helpful for COVID is understanding community and social determinants of health, so that when you're planning a intervention, whether it's a treatment or whether it's a setup of a clinic, a way for them to access healthcare advice, you do it from a position of inclusivity and equity, so that anybody might be able to access those services. So our COVID follow-up clinic is free. If they need to have advice, then we help them out. If they do have insurance and we give them extensive advice, then we do bill their insurance. But if they don't have insurance, then we still help them. So making sure that we had a referral system that was inclusive and equitable, that we had a provision of care, and that we made a treatment protocol of medicines that were widely available and cheap, like on the $4 list, instead of stuff that's thousands of dollars. Those were things that we were able to do and that were intuitive to us because of global health.
All right. So in your opinion, what do you think must happen for this pandemic to come to an end?
Oh, well, that's a great question. I don't think it's just one thing. I think that a vaccine will help, but also wearing masks would help. I think that it's probably going to have to be a lot more of understanding around the globe that we do all impact each other. Yesterday, for example, the entire continent of Africa got certified as being polio-free. And they started that work in 1996. So it's almost 25 years that it took them. And that vaccine, we've known about it for a long time. So it takes a very long time to eradicate something or to even get it under control, even once you have a vaccine. But the director of the African WHO, she used that, news as an opportunity to talk about how, despite having the vaccine and it taking 25 years, what they've gained from that is an understanding of how much they really can up-train community health workers to get out into the field, help people identify, triage, and even treat with limited protocols as long as they have an escalation criteria. And she really talked about community more than science, because the vaccine was old news. It's been around 30 years. But the science did not get them to eradicate polio. Community got them to eradicate polio. And I think that's what we're going to need again.
Yeah, that's really insightful. I really appreciate you taking the time out of your day to speak with us. I learned a lot about global health and medicine today. Before we wrap up, do you have any other final thoughts that you would like to share?
No, I think those are great questions. Thank you.
All right. Thank you again. And this concludes our segment of the In Their Words interview series. Thank you.
Thank you.